In a move that has sent shockwaves through the global health community, the United States has officially withdrawn from the World Health Organization, or WHO. This decision, announced nearly a year after President Donald Trump signed the executive order, marks the end of a long-standing partnership between the U.S. and the United Nations Health Agency. As one of whose largest donors, the U.S. departure leaves a significant gap in funding and influence. The withdrawal comes after months of criticism from the U.S. government, which accused the WHO of mishandling the COVID-19 pandemic and being too influenced by certain member states. The world now watches closely to see how this decision will impact international health efforts. The U.S. government cited several reasons for its decision to leave the WHO. Officials pointed to what they described as the organization's mishandling of the COVID-19 pandemic, a lack of meaningful reform, and undue political influence from member states. The Department of Health and Human Services emphasized that these issues undermine the WHO's credibility and effectiveness. President Trump, in particular, accused the agency of being too China-centric during the pandemic's early days. The WHO, however, has firmly rejected these claims, defending its record and highlighting its global efforts in combating diseases like polio and HIV/AIDS. This clash of perspectives has deepened the divide between the U.S. and the international health community. Traditionally, the United States has been one of the largest financial contributors to the World Health Organization. With the U.S. now officially out, the WHO faces a significant budget shortfall. The U.S. has not paid its membership fees for 2024 and 2025, which amounts to an estimated $260 million in arrears. This funding gap has already led to major job losses within the organization and threatens to disrupt ongoing health programs worldwide. WHO lawyers argue that the U.S. is still obligated to pay these arrears, but Washington disagrees, stating it sees no reason to fulfill this financial commitment. The loss of U.S. funding could have far-reaching consequences for global health initiatives. The World Health Organization has responded to the U.S. withdrawal by reaffirming its commitment to global health. Director General Tedros Adhanom Ghebreyesus described the move as a loss not only for the U.S., but for the entire world. The WHO pointed to its ongoing efforts to combat diseases such as polio, HIV/AIDS, and maternal mortality, as well as its leadership in international treaties like tobacco control. Despite the setback, the organization continues to coordinate global responses to health threats and has called on all nations to work together for the benefit of humanity. The upcoming WHO board meeting will address the implications of the U.S. exit and chart a path forward. In the wake of the COVID-19 pandemic, WHO member states have worked tirelessly to develop an international pandemic treaty. This agreement aims to ensure better preparedness, fairer sharing of vaccines and medicines, and stronger global cooperation in the face of future health crises. The treaty was finally agreed upon by all WHO member states in April last year, except for the United States. The absence of the U.S. from this crucial agreement raises questions about the effectiveness of future pandemic responses and the ability of the global community to act in unison when new threats emerge. Following its withdrawal, the U.S. government has outlined its approach to global health moving forward. Officials stated that the U.S. will now focus on bilateral relations with individual countries to ensure disease surveillance and pathogen sharing. They also mentioned plans to work with NGOs and faith-based groups to continue efforts against diseases like polio and HIV. However, details about these partnerships remain unclear, and there is uncertainty about whether the U.S. will participate in global initiatives such as the annual flu vaccine development. This shift signals a move away from multilateralism and raises concerns about the future of coordinated global health responses. The U.S. withdrawal from the WHO has sparked a wide range of reactions both domestically and internationally. U.S. officials, including Health Secretary Robert F. Kennedy and Secretary of State Marco Rubio, issued a joint statement criticizing the WHO for abandoning its core mission and acting against U.S. interests. They even cited symbolic issues, such as the failure to return the American flag from WHO headquarters. Meanwhile, the WHO and many global health experts have expressed disappointment, emphasizing the importance of international cooperation in tackling health threats. The debate continues over whether this move will ultimately help or hinder efforts to protect public health. The COVID-19 pandemic exposed significant weaknesses in the global response to health emergencies. Studies have shown that many countries, including the US and UK, were slow to impose lockdowns and follow WHO guidance, contributing to the rapid spread of the virus. In the US, a lack of national leadership and politicization of public health measures led to one of the highest death rates worldwide. Experts argue that these failures highlight the need for stronger, more unified international action in the face of future pandemics. The U.S. exit from the WHO raises questions about whether the world is moving in the right direction. As the world adjusts to the U.S. departure from the World Health Organization, the future of global health cooperation remains uncertain. The WHO must now navigate a new landscape with reduced funding and the absence of a key member. Meanwhile, the U.S. seeks to redefine its role through bilateral partnerships and independent initiatives. The coming months will be critical as both sides adapt to these changes, and the international community considers how best to protect people from future health threats. Ultimately, the effectiveness of global health efforts will depend on the willingness of nations to work together, regardless of political differences.